Hello, my name is Dr. Joe Childs, and today I'm going to talk to you about gastroparesis. Gastroparesis is a digestive concern that we see quite a bit of in our office. It's also a diagnosis that a lot of patients come in with, and frankly, a lot of patients are misdiagnosed with it. So we're going to talk to you about gastroparesis. We're going to talk to you about what it is. So if you have a loved one that's suffering with gastroparesis, or you're suffering with gastroparesis, you have digestive complaints because of it, you've been diagnosed with it, this video is going to be very insightful for you. So let's get talking. So what I'd like to talk to you about today is, again, gastroparesis. I'd like to talk to you about what it is, what causes it, and what can be done from a drug-free, functional medicine, functional neurological perspective. I am a functional neurologist, which is a type of neurologist that treats patients with neurological conditions without the use of drugs and surgery and things of that nature. So we're going to talk to you today about the drug-free approach and how it's different than the typical medical approach to helping patients with gastroparesis. So let's talk about what it is. Gastroparesis is delayed stomach emptying of the food in the absence of obstruction. So your stomach is the first place that food begins digestion. So actually that begins in the mouth, but as it comes down through the esophagus, it lands into the stomach, and if at that point it needs to digest, at that point what will happen is we'll get gastric juices, acid, which will digest your food. And then there should be a specific amount of time that the food is in the stomach, and then it should move into the small intestine. With people with gastroparesis, they have delayed stomach emptying, so food stays in the stomach too long. And we're going to talk to you today how that happens and why it happens and what you can do about it. So when people get gastroparesis, they can get all types of symptoms. They can get acid reflux or GERD, and the reason why is because if things are backing up in the stomach, your stomach is going to produce more acid. It's going to be, the food's going to back up, and then it can back up into the esophagus and cause all the different types of symptoms: Barrett esophagus, acid reflux, things of that nature. You can also get nausea, vomiting, because what's happening is the food isn't emptying into the small intestine from the stomach quick enough, and you can start to really back up. You can get weight loss, and the reason why you can get weight loss is because food is not absorbed in the stomach. Food is absorbed in the intestines, and that's where you get your nutrition by proper food absorption. So if the food is delayed in its emptying, it can cause things like malnutrition and weight loss and things of that nature. Also, food needs to be digested in a timely fashion, so it needs to move from one portion of the digestive tract to the next portion. So if you have gastroparesis, you can get bloating, gas, and other GI complaints, gastric ulcers, poor gallbladder and pancreatic function, because there's a lot of acid in the stomach, and when the food comes down from the esophagus into the stomach, it needs to empty into the small intestine. The acidic environment, or the acid moving into the small intestine, triggers gallbladder and pancreatic excretions, and so if it's not happening quickly enough, you're going to have some poor gallbladder and pancreatic function. So gastroparesis also creates long-term problems. So if you have gastroparesis, it's not only going to cause you the digestive complaints that I just talked about, it can also lead to malabsorption of nutrients. We talked about the fact that the nutrients need to be absorbed in the small intestine, so if things are delayed in emptying, you're going to have that, and that's going to create nutrient deficiencies that over time can create dysfunction in your nervous system, brain decline, neurodegeneration, muscle wasting, because again, the food is absorbed nutritionally into the body in the small intestines, osteoporosis because you're not absorbing calcium as well, things of that nature, and fatigue. So these are some of the long-term consequences of gastroparesis. You can also have neurological problems because your brain needs energy, and so gastroparesis is a neurological problem. It's because your parasympathetic nervous system is not working well, and so the brain is highly in control of the parasympathetic nervous system. So we'll talk about that. But we see gastroparesis also has sort of a connection with kids with ADHD, ADD, Asperger's, autism, because the brain and nervous system is not working. So we'll see kids with these spectrum disorders also have gastroparesis. And adults, if you're not absorbing your food very well, you have malnutrition, it can affect your brain, memory loss, Alzheimer's disease, depression, anxiety, mood swings, OCD. all types of neurological disorders can occur when you have malabsorption of nutrients secondary to gastroparesis. But gastroparesis, being a neurological disorder, which we're going to discuss in detail here in a minute, also creates this co-symptomatology, neurological symptoms. So gastroparesis, again, bigger concerns, leads to breakdown of your gut barrier. So your gut, when you eat food, the food is really not necessarily in your body until it becomes absorbed through your intestines into your blood system. And so what happens when you have a poor gastric or stomach emptying, and it's a delayed type of aspect, that can create inflammatory types of reactions in the small intestines, which can create something called intestinal permeability or leaky gut, a breakdown of the gut barrier that connects your outside world to your inside world, which is your blood system. And these types of things can create a leakiness to the gut, which creates these large protein molecules getting into your body, creating things like autoimmune disease, food sensitivities, and systemic inflammation. So these are things that can occur. So this is, if one problem is happening in the gut or in the stomach, gastroparesis, it has a downstream effect on the rest of the digestive tract. So how do you diagnose gastroparesis? Well, they do this thing called a gastric emptying test. It's a 4-hour test, and what they want to see is that in 1 hour after you eat a certain amount of food, 90% or 10% of your food is empty out of your stomach. 2 hours later, 40% or only 60% should be remaining in the stomach, and then at 4 hours, only 10% of the food should be remaining. And so this is, after 4 hours, 90% of your food should be outside of, it should be released from your stomach. So they have to rule out blockages. Gastroparesis is a delayed emptying without a blockage. So they have to do an upper GI with barium and an endoscopy to see if you actually have a blockage, something that's blocking and not letting your food through, which would be a completely different set of circumstances. Now, I see a lot of our patients, we see a lot of patients with IBS and a lot of patients with neurological concerns. I see a lot of doctors, a lot of patients come in with this gastroparesis diagnosed, and they haven't had this testing done. So if you've had this testing done and you have true gastroparesis, then you know you have the issue. So what are some causes of gastroparesis? There's really two types. One is a diabetic gastroparesis, which is caused by neuropathy. People that have type 1 or type 2 diabetes will have nerve damage and peripheral nerve damage. So the nerves that come off of the brain and control different parts of your body, like patients with diabetes will get neuropathy in their feet where they get numbness and tingling in their feet. Well, the nerves that control the stomach can start to develop neuropathy, and you can get poor neurological function and delayed emptying. The other type, which we see a lot more of, is idiopathic gastroparesis. Idiopathic means they don't know why it's happening. However, we do know that there is a problem in the central nervous system. The central nervous system controls all of our body parts, and it controls, the autonomic nervous system controls all of our internal function. And so we know that there's deficient neurological control of the stomach, causing the delayed emptying. So those are your two causes. One is caused by diabetes, the other is idiopathic. So some possible causes of gastroparesis. Well, there is a nerve that comes off of your brainstem. It's called the wandering nerve, or it's also called the vagus nerve. It's truly called the vagus nerve. The vagus nerve comes off of the brainstem and comes down and controls all of your internal functionings. It controls the muscular contractility of your entire digestive tract, but it controls the contractility and the function of your stomach. It controls swallowing, stomach contractions, acid production in the stomach, blood flow to the gut, motility or movement of food through your intestines. It controls the gut immune system, the gallbladder and pancreatic function. So your nerve that comes off of the lower brainstem, it's a parasympathetic nerve which controls all these things, is not working as good in people with gastroparesis. So what happens is the stomach is not contracting, it's not creating enough acid, it's not doing all its functions, and it's not emptying. And so the key thing is the vagus nerve, its function can be improved with functional neurology. We're going to talk about that in a little bit, but this is the reason why people have gastroparesis. Poor vagal nerve function, or poor brain function affecting the vagal nerve. So the medical solution to this idiopathic gastroparesis, or this idiopathic delayed gastric emptying, is these things called prokinetic drugs. They're drugs that actually cause your stomach to contract more. They have a whole host of side effects. One is called Reglan. They'll also use an antibiotic called erythromycin. They'll use anti-emenic drugs, which are drugs that slow down vomiting and nausea. That's because people get that. And so it's not necessarily treating the gastroparesis. It's actually just affecting the symptoms. Botox injections to the pylorus, which is the valve at the bottom of the stomach, to relax that valve to allow food to come through. Now, this is not really getting at the true cause of the problem, because if the cause of the problem is deficient brain and nerve function, so let's say that the brain and nerve is not functioning well, the lower brainstem is where the vagus nerve comes off of. So if the vagus nerve is coming off of the lower brainstem, and the lower brainstem is not functioning as well for any number of reasons, then we're going to have deficient vagal tone to the stomach. And now the stomach is going to have gastroparesis. So the drugs are affecting the stomach directly. They're not affecting upstream to the stomach, which is the vagal nerve or the brain where it's coming from. So we can affect that. Functional medicine and functional neurology creates solutions or stimulations to areas of the brain that affect gastric emptying and can affect idiopathic gastroparesis. So we can examine your nerve function and your brain function, or your vagal nerve function. One thing that we can do is we can just look in the back of your throat and see if you have a palatal paresis, because the nerves from your the vagal nerve controls the palate. It controls it. So if we go and your palate doesn't move up and down as well, or you have a very poor gag reflex, or you have almost no bowel sounds, then we know that you have decreased vagal tone. And there's things we can do to stimulate the vagus nerve. We can also look at the areas of the brainstem that the vagal nerve resides. There's all these other nuclei that live in that area that affect eye movements, pupil diameters, it affects pursuit mechanisms, it affects all these different other functions to see if your lower brainstem is not functioning well, causing decreased vagus function. And chiropractic neurologists, functional neurologists have been doing this for years and helping it. So we can stimulate the vagus nerve. So what's our approach? There are various types of exercises and various types of stimulations to make the vagal nerve fire quicker and better and create what we call plastic changes or improvements in the function in the vagus nerve. And when we improve the function in the vagus nerve, we will in effect improve digestion. Your brain and your digestive tract is completely intimately connected. In fact, there's just as many nerves in your digestive tract as there are in your brain. So we call the digestive tract your second brain. So if we stimulate the vagus nerves, we have probably 5, 6, 7 different stimulations, varieties of stimulations we can do to improve vagal tone function. If we do that over a period of time, we can actually make that vagus nerve function better and not need medications. It's an amazing type of thing that we see happen quite a bit. The other thing that we want to do is we want to identify and remove any gastric inflammation. So we can do what's called functional medicine, which is nutrition. So we can test you for food sensitivities, infection, leaky gut syndrome, which is creating an inflammatory reaction, which is this downstream problem that occurs when you have long-standing gastroparesis. So these are the types of things we do. We do vagal stimulation, and we test your brain and nervous system and vagal nerve to find out if it's a problem. So then we repair the damage created by the gastroparesis. We're going to look for nutritional imbalances, ulcers, leaky gut syndrome, which is when, again, when you get microscopic permeabilities or little small microscopic holes, so to speak, in your digestive tract. You can't see them because they're microscopic, and it allows the food that you're eating to get through undigested, which creates an inflammatory response. Dysbiosis is people that have abnormal levels of healthy and too high levels of either yeast or very unhealthy bacteria in the gut, and we can test these neurological impairments, which we talked in great detail about. So, if you are a person that has gastroparesis, or you have a loved one, or you have a child with gastroparesis, you've been diagnosed with it, the medications aren't really working, you have these symptoms, and you are looking for a drug-free approach, a functional neurologic, drug-free, functional metabolic, nutritional approach to helping this specific condition, what I would say is click on this ad or click on this Facebook post, and what will happen is you will be connected to our website on digestive disorders, and you can learn a little bit more, and you can learn about where you can receive a reduced cost evaluation and consultation for gastroparesis. So again, if you have the problem, click on this Facebook post and you will be directed to our information. Thanks a lot for listening, and if you have this condition, maybe we'll see you soon. Potentially we can help you. Thank you very much.